Okay. So today we're going to talk about the ear. And the ear is actually very fascinating for being such a small object on our bodies. This is a slide we're going to tackle later in the slideshow, but I like to start with this because the eardrum on the right, okay, is what a normal eardrum looks like. When the doctor looks in and he sees a normal, healthy, quote unquote, healthy eardrum, this is what he sees. And it's what they call translucent. It's shiny and it's translucent. Translucent meaning you can see somewhat into the middle ear. You can't see completely, it's not completely clear. But then you go to the eardrum on the right, and this is a very angry eardrum. It's a very infected eardrum, it's swollen. So when they look at ears, especially kids' ears, and they see something like this, that's what they classify as an ear infection. Okay. All right. Oh, I started the wrong slide, I think. Oh, well, we'll go with it. So this is the anatomy of the ear. It's divided into three parts. The external ear, which basically just has the auricle. The auricle, I like to tell everybody, is what we pierce, okay? Then the external auditory canal, how sound gets in. Then we get into the middle ear, and we have the tympanic membrane, or the eardrum. That's, the common name for it. And some bones. We have three bones. And then we get into the inner ear, which is the vestibular area, which has the nerves and the cochlea and the eustachian tube. So the middle ear contains the tympanic membrane, the eustachian tube, and these three bones, which are called ossicles. They're very tiny bones. They're the malleus, the incus, and the stapes bone. And the whole purpose of the bones in the middle ear is just to transmit the sound, which is pretty interesting. The sound comes in, it passes through the tympanic membrane, and then the sound is transmitted from the malleus to the incubus to the stapes into the oval window where the auditory nerves are. So it's basically, I liken it to when a truck rumbles on the highway and the vibrations occur outwards. So that's how the sound is transmitted on these bones. It's like rumbles through them into the auditory nerves. So this is just basically a graph or a chart of how sound is perceived. Okay, we can't measure sound by looking at it, so we measure it by listening to it. So if you have a break in any of these steps, then you're not going to be able to hear. Okay, so when there are hearing issues, it could occur at any one of these issues or any one of these locations. The most common one is in the auditory canal, and it's earwax. When earwax builds up in that auditory canal, that is the number one reason people cannot hear. And we'll talk about some more reasons for not being able to hear a little bit later on in the slideshow. Okay, so these are our combining forms for the ear. Okay, in number one there, auto is usually when we refer to the actual physical ear. Ari is when we talk about the sound along with the ear. Okay, so obviously hearing is audio. So the middle ear is referred to tympano. So that refers to any of the area with the bones and the eardrum. Okay. The stapes, or the bone called the stapes, is stapedo. And the tympanic membrane is anytime you see moringo, that means you're referring to the tympanic membrane or the eardrum. And then another part of the ear is the mastoid bone, and that is part of your jawbone. So that kind of holds your ear in place on the face. So if people have a jaw injury, sometimes their ears are affected. And that mastoid bone is basically just what holds the auditory canal in place. So this is the inner ear, okay, and it is called a labyrinth, okay, basically because the cochlear or the blue part, okay, it is a labyrinth of tubes and canals which amplifies sound, which goes to the auditory nerve. The vestibule is um, almost like a funnel where sound comes in and then it goes into the cochlea, and the cochlea is a spiral area and it just magnifies the sound even more before it goes into the auditory nerves. So there's a lot of different canals at the top of the vestibule, okay, and those are the semicircular canals. So all of these things along with the bone vibrations are what magnify the sounds for our auditory nerves to pick it up. But this whole area is called the labyrinth. So anytime you hear timpano, think of the middle ear. Okay, anytime you hear maringo, think of the eardrum. And anytime you hear labyrinth, labyrintho, think of the labyrinth or the cochlea and the vestibule. Okay. Too many years of loud music might cause this, and it is, I forgot the word for it. Ah, presbyopia. Okay, that kind of thing. All right, so I'll let you guys unscramble that. Okay, so this is looking into an ear with an otoscope. That's the handheld thing that they put the attachment on the end, and it has a light. So this is what it looks like when there's inflammation in the outside of the ear. Okay, so this could be swimmer's ear, this could be the start of an ear infection, it could even be a fungal infection possibly. But you can see the pink and the peach is what it looks like normally, and where we get into the red, and there might even be some infection there, some pus. And if you look all the way down in the middle, you can see the tympanic membrane is cloudy, and that is an indicator that there's an infection of some sort. So we go back. Okay, this is otitis media on the left and a normal tympanic membrane on the right. So ringing in the ears is called tinnitus. And it can be a real low-level ring, or it can be a real high-pitched ring. It can occur with an ear infection, or it can just occur normally in people. There are some people who just have learned to live with tinnitus, and there are other people, when they have a cold and they hear that ringing in their ears, it drives them absolutely bonkers. Okay, so an electronic device that converts sound into electrical implants is a cochlear implant. And this is implanted right above the outside ear, okay? Part of it is on the outside, part of it is on the inside. And all it does is it kind of bypasses the bones, and it magnifies the electrical impulses and allows people to hear. Now, with a cochlear implant, they usually don't hear completely clearly, but since it's converting sound into electrical impulses, it's almost bypassing the cochlea. They put the electrodes into the cochlea, so it's basically a cochlear transplant, but they don't remove it. They just add to it, is the way I can describe it. This is a myringotomy, excuse me, a myringotomy. And this is when they lance or cut into the eardrum. They may have to do this if the infection in the middle of the ear canal has the eardrum so swollen that they're afraid it's going to burst. They would rather do a small incision and then stitch it back up than let it burst, because if it bursts, it usually rips, for a lack of a better term, and it's very hard to stitch back together. They will also do this to release the infection that is in it. And it's, obviously a last ditch resort, because we don't want to be cutting into the eardrum. But if the pressure is so bad that the patient, patients will tell you that if the infection is so bad in the middle ear that it's a number 10 on the pain scale. So again, they don't do it often, but if they think the eardrum is going to burst, they will do this prophylactically so that they can get the infection out, put 1 or 2 stitches in, and then the eardrum heals itself back up after the infection has been removed. They will also then culture whatever has come out of the drainage, and they can get a better sensitivity of what antibiotics are going to work for it. So this is a tympanometer, okay? This measures the pressure of the eardrum in the middle ear, okay? So it comes with these various sizes of tips, because the little ones are for babies and the bigger ones are for adults. So they can tell a lot about what's going on in the middle ear by measuring the pressure against the eardrum. When you go for a hearing test, they will do, they will use an audiometer, okay? And what you do is you put the headphones on and they will say certain sounds and either ask you to repeat the words. If they give you words, they will ask you to repeat the words back, or they will do different pitches and ask if you hear them. So that's why if you look at the little letter A right next to it, that is a button that they use when they do hearing testing, and they'll do a series of different very high pitches, very low pitches. So they can use that information to help to tune a hearing aid to amplify the pitches that the person is not hearing. They will also be able to pick out if they're not hearing certain word groups. They will be able to amplify the sounds in different ways. So what they do is after they do the hearing test, they graph it, and then this enables the people who are doing the hearing aids to fine-tune the hearing aid specific to that individual. Okay, so an audiologist is the person who helps people test for sound, and they also are the ones that will help the patients with getting a hearing aid. Okay, an otolaryngologist is a doctor who studies the ear, nose, and throat. Many times, problems with the ears are connected to problems with the throat and the nose. So they may have to go get all 3 areas checked out. I would say the otolaryngologists are the ones who do the surgery on any of those 3 areas, the ear, nose, and throat. And that's a little bit different than an otologist. An otologist just specializes in surgery on the ear, okay? They are the ones that do the cochlear implants, that type of thing. So these are just all different words that are built from word parts that we've learned in the past, and now we're just adding the ear words into it. So this specialist, okay, who's conducting an exam with the use of an otoscope is an ENT. Again, that's ear, nose, and throat. So they work with patients that have all 3 issues. So this is a relatively short chapter, so we're already on our medical presentation. So what I can tell you is otitis media is the #1 reported ear problem, okay? And that just means it's an ear infection. And it is especially one of the most common pediatric infections. We don't know why. There are people who say it's because babies lay down and things can't drain out properly from their eustachian tubes. Um, Little kids love to put their fingers in their ear, okay? So that is another reason that they get infections, okay? It's usually, middle ears infections are usually caused by bacteria. Sometimes they're caused by viruses. Sometimes it's a side effect of a virus, okay? But it always includes otalgia, which is ear pain. Sometimes there can be otorrhea or discharge from the ear. Little kids will typically pull on their ears and they will be very irritable, okay? So when the doctor looks in it, the tympanic membrane is usually bulging, red, thickened, and I usually say cloudy. That's what we talk about when we see reduced translucency. Now, antibiotics may be ordered if the infection doesn't go on its own. It used to be as soon as a pediatrician saw a middle ear infection, they prescribed penicillin and possibly eardrops if there was some outer ear infection. They trend to not do that now because there are kids who can get an ear infection every month. They tend to now try to um, let them resolve on their own so that we are not prescribing antibiotics so much at a young age. But there are times that they do need to prescribe the antibiotics, okay? If it's unresponsive to an antibiotic, that's when they may go in and do the laryngotomy or lance the eardrum to see if there's pus and discharge that can come through. They'll culture that with a swab, and then they can hopefully get the appropriate antibiotic prescription treatment. So what are some other ways you guys think, or what's a common thing you can think of if somebody gets a recurring ear infection? What are some things that you've heard that they would do? Anybody?
Little kids get tubes in their ears.
Exactly. And what the tubes do is they are put into the eardrum and they allow pressure to be released, and they allow, for some reason, and we don't know why, but it releases the pressure on the middle ear and it allows any infection to drain through the eustachian tube. Okay. So usually you'll see people with tubes who have a lot of middle ear infections, even with a lot of outer ear infections. It's very, very simple procedure. It's very common. And there are a lot of parents who are thrilled once their kids undergo this procedure because these are kids that have had ear infections every month or so. Another one that we didn't talk about is swimmer's ear. And swimmer's ear always occurs in the external canal. And what happens is the external canal gets very irritated by chlorine. If you're swimming in a pool, if you're swimming in a lake, you can pick up different bacteria. And usually our earwax rinses or washes those bacteria out. Sometimes it can even be a fungal infection. But swimmer's ear is usually caused by something in the water. And another reason that outer ear infections occur in kids is because they put dirty things in their ear. Of course, the #1 thing would be their finger, but little kids love to put things in their ears. Okay. Um, Beads are often found in earwax. Little tiny Legos can be found in earwax. I have seen pieces of dog kibble found in earwax removed from children's ears. Kids think that they can put things in their noses and ears and they want to see if they come out. And they, of course, aren't going to tell their parents. So usually when the doctor gets there and he sees something impacting their ear and pulls it out, they're pretty good at determining what it is. So again, that's another reason we don't give little kids tiny things, because they will put them in their ears, nose, and mouths. So it's a pretty simple chapter. Do you guys have any questions about the ear? No? All right, my dears. Well, I will see you again next week. All righty. If you need me in the meantime, let me know, okay?
Right.
Right. See you guys all later.
Yeah.
Yeah.